We've now come up with some different combinations of drugs that you could actually take one tablet once a day that may become more popular. The thing in the United States is that the companies that make these drugs are different companies. So many of them haven't gotten together to put it in one combination tablet like this. So you actually can't buy this combination of medicines in the United States because the companies haven't made it. So there are actually some advantages to generics and companies that can choose which medicines they want to make and put them in pills quicker than we seem to be able to with the restrictions of intellectual property in the United States. So generics are completely legal in many countries, and depends on some of these TRIPS agreement. But the Clinton Foundation has worked to get these prices down. So a year's supply of this triple therapy right now is at about $120, and we hope to get it down to about $80. Now, if you have to go on second-line medicines for whatever reasons, some of these medicines have interaction with TB medicine, so you have to switch, and the regimens become a little more complicated, more tablets, and we usually use a pill box if they become more complicated than 1 or 2 tablets per day, twice a day. But if you fail this regimen because you didn't take it properly, or because someone gave you resistant disease to begin with, so if someone who has HIV develops resistance to these medicines, and then they transmit that virus to someone else, that person will fail this regimen also. So they'll already have resistance. So it's so important, for all these programs to really pay so much attention to adherence. And one of the things about this model is that we think it really pays attention to adherence with a community health worker and a accompagnateur to prevent that. Because otherwise people are going to develop resistance, and not only are they going to have to go on second-line regimens, but then they can spread that disease to other people who will also be. A second-line regimen right now is about $1,600 in this country. Clinton is also, and others are negotiating that price down. We think we'll get it down to about $600 around by this year, so that'll be good.
Can you just say one thing about your experience as a doctor here compared to the United States on adherence in your model? Talk about adherence in the model here, because I know it's really impressive.
Not just my experience, but studies have shown that in the United States, and especially in the people in the United States, are now paying more attention to adherence. So I think things have actually gotten better there. But 4 or 5 years ago, studies showed that, correct me if I'm wrong, Louise, but at the end of 2 years, about 50% of the people would be in need of different regimens. And it was in a time period where we didn't really know that you had to have 95% adherence. So I think things have changed in the United States. But with the accompagnateur system and really paying attention to adherence and supporting the patient, we're able to get much higher adherence rates than traditionally we can get in the United States. We have some hard data from out of Haiti showing viral load suppression at the end of a number of years of treatment is very high. Close to 90% of the patients are still virally suppressed. So when you measure the virus in their blood, after being on the medicines, you can't detect it, meaning the medicines are working. And in the United States, some studies have shown that if you don't adhere to medicines at about taking 95% of the pills correctly, about half the patients will develop resistance in about 2 years. So, and most of the patients in the United States in the years prior weren't taking their medicines with such high adherence rates. So now there's a big emphasis everywhere to do that, and I think the programs that are successful in sub-Saharan Africa will be all programs that somehow pay very close attention to adherence and support the patient in many aspects so that they're able to take their medicines. It doesn't sound difficult to take that pill once, twice a day, but if you add on that they really have no education of really what a virus is, what a pill is, add on poverty and all these other barriers that they have to taking that, and just think about how the last time you had to take medicines twice a day for 2 weeks and how difficult that was, you kind of realize, the accompagnateur system is probably one that is quite beneficial. When I first heard about the accompagnateur system, I was probably not a believer. I was kind of like, okay, I worked in tuberculosis and we do directly observed therapy for the whole treatment, but it's 6 months long. But when I first came to Partners in Health like 7 years ago, and I said, okay, so we're going to do directly observed therapy for life for these patients. I was like, that's just never going to work. But then after working in the system for a little bit, you see that there's a couple things that aren't considered, and one is that that it is just extremely hard to take a tablet every day, twice a day for the rest of your life. And if you don't put heavy support systems in there, you're not going to have success. I also think just employing an accompaniateur, even if they weren't doing anything, that in this area of extreme poverty, that to sprinkle money in terms of employment out to a number of people, most of them being women, a large percent of them being HIV positive, would not even be a bad thing just in itself. But you add to the benefit that you're going to increase adherence, you're going to increase psychological and social support for the patient, and all these things. You get this. They're going to be able to, pick up pregnant women early, not even who have HIV, but who don't have HIV, but ones that do have HIV. You can do PMTCT. So you have all these benefits of hiring this person to just visit them daily every morning. And it's not about trust or watching them take the tablets. It's really about supporting and solidarity, saying, recognizing that this is a really incredible hard thing to do, to take medicine every day for the rest of your life, twice a day. And we think it's so hard, and that in solidarity we're gonna assign someone and actually pay them to help you through this and support. So that's what it's more about.